Okay, we'll go ahead and call the meeting to order and ask for motion on the minutes. All right, if there are no objections, the minutes will stand as recorded. And I'll tell you what, I guess before we get into the business of our Family Justice Center intervention and public safety coordinators, I'll just go through and maybe cover some of this other stuff as we're waiting on a few council members. Is there anything under pending presentations that we need to, I guess, cover or go over? Anything that any council person has under a pending presentation we need to talk about? Okay. All right. And it's my understanding that this afternoon, Councilman Ledford, we've got a pretty lengthy planning and zoning meeting. All right. So we will plan accordingly for that. Get your lot. Or your button. There you go.
Thank you, Chairman. I have made, Karen and I have worked together to strategize on efficiency and time
Okay.
for the council. And I think you'll be pleased, sir.
Okay. All right. Good deal. Thank you, sir.
Mhm.
All right. And then if you will look down to board appointments, it does look like we have several vacancies there. Madam Clerk, on the IDB board, Industrial Development Board, we have one vacancy. Is that the way I'm reading that? We have one vacancy. So in District 5 and District 8 does not have a district-specific appointee. Is that correct? Okay. So Councilman Byrd and Councilman Hester is not here at this moment, but I'll talk with them about maybe who wants to make that appointment. All right, it looks like we have at least a majority of our council people here, and I want everyone to be here. We had a discussion during our budget hearings about the role and what is going on with our public safety coordinators through FJC. So I'm going to ask Chief to come up and kind of kick this off, and then if you have any questions, we'll follow up with that.
Absolutely. Thank you, Council. I'm happy to say that I will not be the primary feature this afternoon. I do want to outline a couple of things before we get started. The first one being is that in an effort to really focus our public safety work, we have brought our interventionists that were previously at the Family Justice Center underneath our Office of Community Health, who are working alongside our public safety coordinators and outreach staffers, which is fantastic because that means that we are moving toward alignment. And in the Kelly administration, one of the things that we are really excited about is breaking down silos between departments where we have individual responsibilities that all touch this really important systemic problem. And while we may be in different departments, we need to be working together. So one of the things that is emerging that I'll talk about a little bit later after our speaker wraps up, but is how we're moving toward that cross-functional vision. But before I get there, I want to go ahead and introduce our director of the Office of Community Health, Dr. Mary Lambert. Dr. Lambert is, as you all know, extremely qualified and has been leading our community health work in the face of COVID, which has been really urgent and necessary, but has also been leading up our work on developing a public health framework for the way that we approach violence, particularly youth violence in our community. So without further ado, I will go ahead and bring up Dr. Lambert, and then if we could get the presentation on the screen. Thank you.
Good afternoon, Council.
Good
afternoon. First of all, I want to just say thank you for all the support that I've received in the mayor's office and from all of you. I've not been at this podium in more than a year when I presented as a part of a presentation for Older Americans Month some time ago. So just to make sure that I get the the right slides going. I may bring Joda back up again, because there's some data slides I want to make sure I don't miss any details on related to some of the trends that we're seeing related to violence, especially among youth. We are looking at the need for a public health approach to the prevention of violence among youth, gun violence reduction. For me, this began after I began in the Office of Community Health, appointed by the Kelly administration. And on June 4th, Mayor Kelly talked about the gun violence is cascading, that it's multiplying, the shooting and how it ruins the lives of dozens of families across our cities, and that we really do need to address in a very cross-functional way a public health crisis, which it truly is. I am familiar with a public health approach to gun violence prevention. Two of my assignments on active duty were with the Centers for Disease Control and Prevention. I did not work directly in that center, the National Center for Injury Prevention, but I'm aware of that work, some of the fine work that they do, and some of the models that they funded through grants and other mechanisms in cities across the country. I am also an associate professor at Vanderbilt University. I teach public health policy, epidemiology, and evidence-based practice. And one of the things we try to make sure, and I always try to make sure when I talk to folks, so that they have an opportunity to view the concepts of prevention, the levels of prevention, and the need for one level versus the other, depending on the problem that we're dealing with. Primary prevention, trying to prevent the occurrence or reoccurrence of gun violence in this case, violence or gun violence in this case. It's akin to folks not smoking at all. Don't begin smoking. Then we don't have the issue with cancer, with deaths because of smoking. So just preventing it in the first place, so primary prevention. I'm not sure whether some of you may be familiar with these concepts, but I think they're very important to framing how we go about the business of addressing youth violence and gun violence. Secondary prevention, trying to detect the problem early. We've got some situations in our community that we need to detect early and begin to or continue to do program activities that prevent or mitigate further progression, further violence. And then tertiary prevention, that is often what we see ourselves doing, and that's reacting after we've had a violent occurrence in our community. The terrible tragedy at the Grove Street with the 7 women, that's what we don't want to see. We do need to address it. We do need to respond to families, to individuals, to the community, but we want to prevent that. So if we can, we want to start at the primary prevention level so that we don't have to react quite so much. There is quite a bit of work that's been done around preventing violence, youth violence, gun violence. There are 4 key questions that need to be addressed when growing or establishing those interventions. They seem pretty straightforward, but many times I think we move out and we don't necessarily ask ourselves and get a really hard framework around what the problem is, the who, the when, the where, what the causes are, the role of drugs, alcohol, domestic violence, mental illness, the role of stress, the role of gang violence, and other factors. What do we know that works from the literature, best practices that can work in our city? There's no cookie cutter approach. It needs to be an approach that works for Chattanooga, for the situations that we are dealing with. The research, and there's lots of it out there. There are lots of best practices in other cities that we can take a look at and that we are taking a look at for potential use in our community. Some of the examples of what works include the mentoring. We've got some of that going on with some of our staff, counseling, both individual and group. And then there's also opportunities for grants to individuals and to groups to assist with reducing youth violence and gun violence. The final question is how we can grow and develop effective interventions. I think we can start with what we have currently. Before we go into that, I do want to talk about some of the data that we have related to the crimes in which a juvenile was a suspect with a firearm from January 1st to November 8th, and this is from 2017 to 2021. I think I'm going to step aside and ask Joda if he would go through this data. He certainly has a lot more history with it, and I want to make sure that you get the fullest picture possible of the data and what we've been seeing, and then I'll step back in and talk about what we currently have, what we're doing, and where we're going.
So I just want to really quickly cover this. This is part of a grant application that we put together for some technical assistance from Bloomberg, and we had to request some data as a part of it. And I thought that you all might find this interesting and troubling simultaneously. So I stepped back really quickly. So part one crimes are violent crimes, and this is the chart where we see a growth in violent crimes from 2017 to 2021 involving juvenile suspects. But then it becomes even more dramatic and concerning when we just look at firearms. These are the kinds of crimes that result in bodies. And whenever we see, a 38% increase in 1 year, we have to ask ourselves what's going on. And I think it's worth noting, in some of the, I think what Dr. Lambert's going to cover is that, and something that struck me as I was talking to our intervention specialists and our Troy and Deborah and others, was that over COVID, we had to stop doing a lot of the face-to-face work, and we did not have as direct avenue and access to kids, to youth that were our most vulnerable and most susceptible to violence. And I think that had an effect. I think the work was working. And whenever we saw that, and this is true across the country, right, where young people no longer had access to the mentorship. They no longer had access to the programs. And we saw that collectively, while maybe not each individual program we can say, we can point to an effect, but collectively it had an impact to see that suddenly gone. And so I wanted to flag that we do have a challenge here. This is something that whenever I saw this data, I was concerned, the mayor was concerned, and it became a real eye opener for us. But then also too, I want to point out that it's not the idea of juvenile suspects in part one crimes is part of the story. The other part of the story is that many of the people impacted are also the victims, and oftentimes they're, you're a suspect one day and a victim the next. And to see this growth in violent crimes involving juvenile victims is deeply concerning. And a lot of times we saw maybe about 100 less than this original number. The 830 number, I think it's in the mid 700s, are repeat offenders, right? Or these are folks that have been through in and out through the system. So very few of these juvenile suspects are folks that we haven't seen before. And there are early warning signs, which is why the intervention work is so important. So with that data in mind, I'm happy to answer questions at the end about this. I want to turn it back to Dr. Lambert to talk a little bit about what our intervention specialists are doing.
Chief, hold on one second.
Yeah.
Oh, Councilman Lefford, you took your hand down, so.
Yes, sir. Joe said he'd like to take questions at the end.
Okay. All right, go ahead.
Thank you, Joda. I just want to make sure I haven't missed any notes that I wanted to go over before we move on. Okay, our current team, and it's been a real pleasure to get to know these individuals. Certainly not as many folks as we need to have engaged in this work. Some of them are here today. Troy Rogers, Public Safety Coordinator, Deborah Maddox, and these individuals may be known to many of you. Tommy Harper, Pablo Alvin Lee Jackson. He's actually the newest on the team as an intervention specialist. He was hired early in the pandemic. And Ruben Mirianti, who has been quite involved with this work, and then has also been very involved with the work of helping to stand up the Office of Community Health and related to pandemic work and the grant that we received from the Department of Health and Human Services. That said, these individuals, these 6 individuals, have been very busy, and I think sometimes they're so busy that we've not seen all of the work, all of the efforts that they have put into addressing the needs, as many of the needs as they can in the community.
Dr. Lambert, before
Yes.
you go on, I see Troy and Ruben here. I don't know if our new council members know
Ah.
who these individuals are. So if any of these other individuals are here, I think it'd be good to
Yes, sir.
recognize them so that
Thank you, sir.
be
Yes, sir.
introduced to them.
Agree. Alvin, the newest member. Okay. Thank you. And everybody knows Troy. Deborah Maddox,
Yeah.
Pablo is not here. He's not here today. And of course, Ruben. And Tommy. Tommy's going to kill me. Okay, Tommy. I think I talked to Tommy more than anybody else. Okay. A pleasure to work with. I've had the opportunity since beginning this appointment to have one-on-ones with all of them, to get briefings on the work that they've been doing, the activities that they've carried out in the community, they continue to carry out. Ruben, I believe, has had a double portion because he unfortunately has to see me every day for lots of things. So it's a real privilege. We just don't have enough of them. Some of the current activities that we're engaged in through our intervention specialists and our public safety coordinators. Oops, one too many. This is sensitive. Oops, I have really messed up now. All right, how do we get this started?
We can get over to slide 9 and then we'll screen it again if you don't mind.
Okay. Okay.
And then, yeah.
That is not
You
good.
can hit the present button.
Do we have somebody over there? Okay.
Yeah, oh, we do. Sorry.
Okay. Let me make sure I'm where I want to be. All right. Okay. So some of our current activities to prevent violence in Chattanooga, our intervention specialists provide mental health support to school children in our schools, and I do find that many people are not aware of that. Again, they're so busy that we don't have quite the time to really give them the visibility that they need to have, although they do tell me, and I have seen the evidence of the requests, the inquiries that they get for additional assistance from schools, from principals, from teachers. There's some other areas of their outreach which include mental health enrichment training to community leaders serving youth. They have worked with social work interns from Southern Adventist, from UTC. And I must say, I've seen presentations from some of the work and the pilots that they proposed, which I think have been really great. And more than a few of these will be graduating in the spring. So we've got some great selections to make as far as individuals who can help us further this work. Community outreach and collaboration with local organizations is also ongoing by these individuals to further the support for newcomer children. Recent activities of our public safety team. It's quite a few. This is just a sampling. Everything from justice involved career prep and job fair. I've attended a few of those. Of course, since we're still in a pandemic, I get to listen to those, and then I get to do the spiel about COVID-19 and the needs for prevention and vaccination and that kind of thing. So I've seen a few of these justice involved career prep and job fairs, and they're really great. Victim support. quite a few of these activities. I know that I speak with or get email communication from Troy quite often related to what he's having to do or what others are having to do related to victim support. Archer Knott Middle School, CPD Public Safety Partnership, a 10-week pilot after school mentoring initiative at Archer Knott Middle School in collaboration with, I have to say that this is really gratifying for me to see the work at Archer Knott Middle School, some of the work at other schools, just because these are my roots. And on the West Side, I was born to the West Side, spent some early years at on the West Side, living in the West Side before moving to East Chattanooga. Went to Archer Knott Middle School and attended Brainerd High School. So to see this in the schools that I came through, to see the things that are going on, but to also know that we have individuals who are professionals who are working to make things better. The Distinguished Gentlemen's Club, this was in November, this was last month, and it's a mentoring event for middle, high school, and college age males. And I've seen some of the evidence of how effective those programs are. So looking forward to seeing more of that and being able to do more of that work in the community. Our public safety team works cross-functionally, and that's by design and will continue to be our design. Mental health awareness and education with students who are new arrivals or migrants at Howard High School. Cyberbullying education and awareness with Woodmore, with fourth and fifth grade classes. Members, we have staff who are members of the Hamilton County Children's Cabinet, a member of the Early Matters Coalition, members of the Tennessee Region 3 Planning and Policy Council, members of the Children and Adolescent Subcommittee, and member of the Early Childhood Health Equity Working Group. These individuals are the staff that we have currently are quite busy, quite active, and I believe quite productive. And they are the answer to many of the situations that we see and the answer to reducing youth violence and gun violence in our community. Some upcoming initiatives, I'll speak on this for a minute, and then because I work with Joda so much on strategy and policy, we've got a lot of initiatives that are poised to make even more of a difference in reducing youth violence and gun violence in our community. We want to make sure that we continue that effort and that we support the wonderful staff that we have currently engaged in these activities. And I'll be ready for questions. I want Joda to come up and just talk about these initiatives.
Thank you. And I'll just be brief here, and Frank, we're still in the process of developing our strategy around youth violence, but I think we're coming up pretty quickly on it. We have some meetings with the National Institute for Criminal Justice Reform, and they have this specific unit focused on gun violence. Several cities have also launched something called the Office of Violence Prevention, they all have different kinds of names. Milwaukee, the city of Washington, D.C., several others, Stockton, California. And we're starting to learn from those cities about the strategies that have worked. And with the onboarding of our new chief operating officer who's with us today, we are beginning to pull together a cross-departmental team consisting of folks from the U.S. Attorney's Office, our city attorney's office, Chattanooga Police Department, our Office of Community Health, to begin the work of really pulling this core team together that's going to be really specifically responsible for responding and preventing youth violence. Also, our community development department. In the first quarter of 2022, we anticipate being able to launch our crisis response teams, which is a team of social workers that you all have voted on and invested in our previous budget. And we hope it's right around the same time having the opportunity to release our comprehensive youth violence prevention strategy. And then I think it's also going to be important to note that we're talking a lot on the prevention and intervention side, but some of this is also an enforcement question, and I think it is going to be essential that we have a creative new police chief that is ready to come on board, and that hiring process is ongoing. And then I'd be remiss not to mention the American Rescue Plan dollars that have come into our community and the specific provision that has been granted by the Biden administration to invest in community violence prevention efforts through those dollars. And so we certainly know that that's an opportunity for the city of Chattanooga to make a serious dent in violence reduction. And we also see the root causes of this, the root challenges in violence often start far earlier and on the early learning side, but then also on the economic opportunity side for kids who frankly lose hope before they've even gotten started. And so being able to invest in entrepreneurship and economic opportunity is something that we're really paying a lot of attention to. So with that, I'll turn it over back to Dr. Lambert and myself as you all have questions. So I'm giving the floor back to you on the council and chairman. Thank you.
Councilwoman Burrs.
Thank you, Mr. Chair. Actually, this is for Ruben. Hello, my friend. How
Hi,
are
how are
you?
you? Good to see you.
We've worked a long time on this, and I'm glad to see it coming together. You and Tommy and Troy are, and Pablo, who's not here, but several of you are the most experienced around in being in the trenches. This is a difficult question. I'm not meaning to put you on the spot, but I would like to know the answer. We spent a lot of time doing this and coming up with strategies and all of those things. Are you being allowed to use all of that now as you're setting up the program, or are we starting all over again?
No, I don't think it would be beneficial for us to start all over again. I think what we're going to do is assess what is really working and identify where there might be some gaps that we can improve upon. But I do think that the work that's happening right now is working. The work that Tommy and Pablo in the schools or they're doing is working, is showing results. So it would be illogical for us to say, well, we have to start over. I think what we want to prioritize is what do we see that's really having an impact, especially in our young people, so that we can grow that and then add any pieces that might be missing for
That's
it to be
great.
a little bit more effective.
Good. I am so glad to hear that. I didn't want us to be going back again with all, you're laughing, Tommy. I mean, you guys have clocked so many hours and you've done so much work, and we ought to be at the point now where we can identify the gaps pretty quickly. I know that Orchard Knob for a long time was just the only school that would really let us in, and that principal was great. So I guess my second question is, how is the school system? Is it gotten friendlier and more open to letting you in?
I think it has. I think that the word is starting to spread as to what Tommy and Pablo have been able to accomplish. We would like to be in more schools. I think that the biggest factor preventing that is staff. I
Okay.
think that we can do more with more, but as of right now, I think the gentlemen are doing an amazing job in the schools that they are in. And from time to time, we'll have requests on one-offs, like we just had Woodmore contact Pablo, and then Pablo referred it to me to address cyberbullying. And they were so impressed with the 5th grade class engagement that I'm gonna go and talk to the 4th grade as well. And then we had a session just for the new arrivals at Howard, talking about mental health and what that looks like for a person who made a very dangerous journey and is here currently right now, what mental health looks like.
So I can't think of anyone better than you and Tommy, from maybe the health point of view, Troy from the violence point of view. You guys have done a great job.
Appreciate that.
Will you be able by budget time to have it together to at least try for the people you need?
I think so. I think working alongside with Joda and Dr. Lambert, we should be able to have a strategy going forward as to what, option 1 and option 2 might be. I think bringing multiple options would be our best bet.
Thank you. And thanks, Tommy.
Thank you.
Councilman Ledford.
Thank you, Mr. Chair. This question's for Joda. If you could swing back to slide 5, please. Yeah, you got it. So one of the strongest areas I think our city has been blessed with is in acquiring data. I really believe that. We've done a fantastic job of that. Now we need to use it. So Joda, here's my question. From 2017 to 2021, from the 632 to the 830, do you know if there's been a shift in age?
It's a good question. I
that
don't
make
know
sense?
that. I mean, I think anecdotally, we've heard from the police department that we've had folks getting younger. That is something that we have heard from, and I've heard from Chief Tucker. I can check and see with the data is available. We can certainly provide that as an age breakdown.
And unfortunately, I was afraid that was going to be the answer. So that should tell us something. I'm really grateful for this process. Everyone who's here today, I know a lot of you. Thank you, Dr. Lambert, for leading this. This is serious, and we need to address this full on. And I believe we're going to do that because I believe in what I do know. The age is getting lower and lower, and I also know a little bit about, just a little bit, because I have a 12-year-old about to be 13, and I know, watching him just from year to year, his thinking patterns or how he reacts to things are so different, a 14-year-old versus a 16 or even an 18-year-old. And I'm very appreciative that we're keeping that thought going and addressing that, because we're getting to some really root solutions. So I'm very excited to see what's going forward and very supportive of the work you're doing. Thank you very much, Chairman.
Thank you, Councilman Ledford.
Councilwoman Coonrod.
Thank you, Chair. I got a couple of questions. Thanks for the presentation. But what school, I heard you mention that they are in different schools. I know Pablo is at Howard. But what are the other schools that you guys are working in?
So we are Howard, Woodmore Elementary, East Ridge High and Middle. We're also Red Bank. And are we in Brainerd yet? No? Yeah. Prior to COVID, we were at Brainerd, and we're still in the process of figuring out how that's going to look like moving forward to re-engage with and Washington Alternative, yes.
Okay, thank you. So we don't have anyone going to the schools where I see.
What
and
schools would that be?
witness, where kids are coming from the west side, kids are coming from Eastdale, kids are coming from the areas where they're wearing guns, carrying guns like they wearing a belt.
We did engage Delwood, but not. Yeah. So Delwood, we have presence in, but the other ones we haven't. We can definitely make an intentional effort to get into the schools. And I think by possibly coordinating with the schools that we're in as to demonstrating the work that we've done will make it a lot easier. I will say that any school that we engage with, we need to be invited by that particular school. And sometimes getting that agreement takes a while because they have to figure out what time during the day we're going to engage with them. And the biggest concern is that the time that we have with the students is not during a core class. It would be during what I used to consider electives. I think they call it something else now, related arts. So figuring that out has taken anywhere from a couple of weeks to months to be able to have a specific timetable as to when we can engage the students.
Thank you. I appreciate that.
You're welcome.
But I do know for quite some time we've been having this same conversation about reducing violence. And I mean, and then something tragic happens. But we let it fall to the wayside. And back in 2018, if I'm not mistaken, an organization was called Father to the Fatherless that went into the schools. Not to fund that organization for whatever reason. And here it is now, we're still talking about the same issues with the same questions. And now, since then, unlike my peers, is that, they see Pablo and Tommy working in the schools. But what I see is Troy. I see him in the community day in, day out, in the wee hours of the morning, trying to make sure he reached those people that need. And one important piece of the puzzle is not even here when we're talking about the violence that our youth are engaging in, and that's Joe Hunter. Kids refer to him as Uncle Joe. He's nowhere in this room. He's dealing with the kids that we often keep talking about as if they're not even human. He's the first point of contact when a gun or when they're running and ducking and dodging from gunshots. And Uncle Joe. They're not calling Tommy. They're not calling Pablo. They're not and it's nothing against you guys. And they're calling, but yet we refuse to hire more people to work with these individuals. And yet we're saying, oh, well, we need the staff. So outside of that, I want to know, and it was a great presentation, but I want to know, and this may be more for administration, because I know Dr. Lambert and Troy and everybody can only do so much, but what are we doing to reduce absolute poverty in these neighborhoods? Because we know that it's concentrated in our communities, and these same group of people are going to the same zone to keep you in these schools. The same societal issues that it's more than just dealing with drugs, domestic violence, mental health issues, and all the things that you guys named. What programs is there talking about premarital sex? Where's the data that we see time and time again that says if you're raising kids in a two-parent household, how that reduces violence? No one has shared that here on this, in the presentation. Nobody is producing the data. Where are the additional credible messengers that can go into those that's gonna go to the west side? And Tommy, I don't know Tommy personally, but I've heard his story. He need to be walking the streets in the west side. It doesn't matter what the color of his skin is, because his walk of life has been the same as mine. We need people like Tommy to be out in these communities, and it don't matter what color that you are, but we need people that they can connect, that they can identify with, people that's gonna be real with them and change their lives, not just for their kid, but it has to be a family effort, a family effort. And I want to know what this department is doing to reach the family to change their lives in that way. What can we do with the resources that we have, with our recreation centers that we have? What can we do? What is the plan outside of we want to go, this trafficking these kids going through? Children and families, we know what the data say, that they're gonna thrive when they have access to safe and stable, nurturing environments. It's lighting up an area, tearing down these dilapidated properties that the city government own and the county, investing in those communities to deter crime. Art, no one has mentioned art. What are we gonna do? How can we use art to help reduce the violence that's taking place in our communities? It's got to be more than time and time going on. I'm passionate about this stuff. My community, we're affected. And it doesn't look like, what you think, not just in my community, it's everybody's community, but in my specifically, it's talked about more. Doing to change the cultural norms and social norms when it comes to people of color in our communities. What are we doing to change that narrative in our communities is no longer accepted?
So I want to touch on a couple of things. There's a lot there. I think one, I just want to acknowledge that I hear your frustration. I think the mayor and myself and others hear that frustration every day, and it's completely justified. I think, respectfully, this administration is the only thing I can speak to. We've been in office for a little over 6 months, and we take this extremely seriously. And I think that our perspective has always been that, if you want to go and make a difference, you have to plan for success, and you have to take stock of what has been happening and what has worked and what hasn't worked. And I think that there has been some sense from, and I heard the list of systemic root causes, which is how we're thinking about it too. It's just to say that opportunity is at the root of what either will result in ultimately in violence or opportunity for our families. And so that has been the focus of this administration from the very beginning. Throughout the campaign, Mayor Kelly talked about how important it was to start early from prenatal care, which is why, we've recently rebranded and refocused our work with Baby University to be focused on families in community centers, which is why it will now be named Family Forward. But then also on top of that, you mentioned art and our creative economy and entrepreneurship. These are places where before a child picks up a gun, and we are talking about children, they have to have the opportunity to pick up a laptop or a paintbrush or a skateboard and think about the ways that those opportunities can lead them to a better life, to restore hope. And in some ways, I think the frustration is it's kind of like boiling the ocean. And where do we start? And we have chosen to start, one, with the public health approach to community health, and then second, to really focus on economic opportunity for our families. So Councilwoman Coonrod, I just want to underscore that we completely agree. This is a systemic issue that's broader than any singular violent incident. And Troy and Tommy and Deborah and Pablo and Ruben are instrumental parts of that, but they can't do it alone. They've got a lot on their shoulders. And so you'll see from our administration's approach in the way that we're approaching our ARP investments that we are going to be making significant financial and time investments into both the root causes of lack of opportunity, but then also to the sort of short-term violence challenges that has particularly affected us over the last 4 or 5 years.
You good, Councilwoman? Thank you. Councilwoman Hill.
Thank you, Chair. The dip in violence and gun violence in 2019, followed by the escalation in 2020 and 2021, follows something that we're seeing in the schools, which is an increase in bullying. We, much like what you all have concluded, the student team and the adult leaders have identified within the schools that not having the programming, not having the students participating in conversations about bullying contributed to an increase in bullying now that we're back. We have school buildings where we've just had some really horrendous, some of us might say ridiculous behavior. And there's certainly some learning of what it is to live in community again now that we're back. All that said, public health crises like the coronavirus pandemic this is probably not the last we've seen of them. We have another variant that's popping up, and they say, if we don't have herd immunity as a planet, that we will continue to see these viruses sweep across our countries. Help me understand, Dr. Lambert and Joda, how your thinking is evolving about what the risk-reward scenario is for an appropriate response to providing these type of services, which we've acknowledged are part of a public health crisis, in the face of the current and future public health crisis. To put a finer point on that, our community centers were closed and then reopened, and then this administration closed our community centers again. While we have other institutions, schools, and childcare facilities that have lots of little tiny human beings in them that are figuring out how to do that safely and provide those services. So walk me through how we're going to protect the work that's happening by this team as we continue to face other health issues.
I think you hit on something that has been an active focus of our discussion as an administration, and you've even seen our thinking evolve in some ways. And I think there's, frankly, humility that we have to bring to an evolving public health crisis that we haven't seen in several generations like this. So, to your point, Councilwoman Hill, this is exactly why we opened up our community centers again. And I think that we had a robust discussion about it from this administration, and it is a balancing act. And I don't necessarily know that the equilibrium of it is knowable, but we do know that these services also do provide a public health and public safety impact. And so we have to balance those things. And so I'm not pretending that this is an easy question. I think that we have to grapple with the answer. And right now, the answer, it's more important to have our community centers open. I think that changes as the pandemic and the virus changes. And that's something I'll turn to Dr. Lambert to talk a little bit about the ways that we are preparing for the next stage of this pandemic and the ways that we're preparing our community centers to weather this. And in some ways, we've moved from emergency response to resilience, and that's a little different of an approach. But I'll let Dr. Lambert speak to how we're tackling this.
As Joda mentioned, so much of this is a balancing act. The last thing we need is, community centers opened with, in many of the areas around some of those community centers, very low immunization rates. And those immunization rates are the reason, those low immunization rates, below 70% or higher, is why we have the variants. The variants are going to occur as long as we have lower vaccination rates. So we've got to work on that, but we've got a balancing act of, we need the community centers open as well. Some of the programming that we want to make available through community centers with our nurse navigators, they're being funded through the HHS grant. We need them to be able to get into those community centers and work with those families, work with those children for so many activities. But what we don't want are our community health centers, our community centers open and be the source of the spread of infection among the individuals utilizing those centers. So we've got a balancing act. We're putting measures in, we have put measures in place so that we are as safe as we can be. But an indicator as far as whether we can keep them open is whether or not we see the occurrence of increasing numbers of infections. So when we see that, the balancing act is, do we keep them open and continue that spread, or do we close them, sanitize, and then reopen with additional measures to make it safer for the individuals in the community that are using those? And again, we need those community centers open from a program standpoint. Ma'am?
It occurs to me that we might need to think in all different terms about how we provide the services we provide. Because it's highly likely that our staff members are vaccinated. And I think about this across a lot of our city services that just stopped and our workers went home. And they did some sort of work, but not the intended work.
Mhm.
And I have found with our school response, to public health issues that, in the face of a very complicated problem, a complicated solution was appropriate. And so I wonder if we get to a place where our community centers are closed, might we have some of our social support groups in our parks? Well, I mean, how might we think differently about that? And I appreciate what you've said, and I just encourage you all to continue to think about it in all the different grays that are on that continuum between open and closed, knowing that the work that's being done has been determined to be important.
Agree. I really agree with you. This complex situation that we're living through now, it's going to take complex solutions. We had a few more options when the weather was warmer, but as it gets colder, there's less and less that we can do outside in a safer environment, that kind of thing. So we have to be very creative in how we put programming back in place in the community centers, protect the individuals who are utilizing the community center programs. And one of the points that we had to have that we considered as we reopened those community centers was the vaccination levels of the staff, because we're concerned about the safety of the staff as well. So you're right, it is complex, and we will be as creative as we can be, using the best models that we can identify, as well as utilize from other cities who have some marvelous ideas that we need to at least think about and potentially utilize. But complexity is probably going to be the name of the game. And hopefully we learn lessons from what we're going through now for the next occurrence of whatever.
Thank you.
Councilwoman Coonrod?
Thank you, Chair. I just have one more question, and if I can, just address Ms. Deborah and Troy. I would really like to know, like, what do you guys need as far as support that can, help you with your job and what you're doing on the violence side, the work that you all are doing?
Troy, Deborah.
I think what we need a little bit right now is time, only because, they've closed the centers. We have some initiatives that we wanted to bring to the centers, but we couldn't because of it being closed. So now we've got to get back with the new staff, as the former Councilman Oglesby is now over the community centers. I met with him, and we're going to be pulling together some staff to look at some initiatives that we can bring to the community centers. Also, in getting out to the rest of the community, we're looking at the Emma King Day of Service, bringing a See Something, Do Something program. Also, we're looking at other initiatives such as soul boxes for individuals who have lost family members, to bring about mental health healing. So we're looking at some different initiatives. We just need just a little time. Because of the pandemic, we have got to be careful in how everything is brought out to the community. So, Troy.
I would say for me, and thank you guys for having me, it would be mentoring on steroids. And it would be staff with a sense of urgency. I think those two things would do us well.
Troy, to staff in the sense of staff you don't have currently, in other words, just.
Well, I'm just saying, period, staff with a sense of urgency. What I mean by that is that understanding that we are in a crisis right now, epidemic and a pandemic, and we just need people who do work for the city to just step up and do the very best that they can. I feel like the city, with the workers that we have, we could be doing more. And I'll have to be honest about that. So I'll just say a sense of urgency, one, and then just mentoring on steroids. Our best year in violence was the years that we were in the schools, Orchard Knob, Brainerd, Howard, Dalewood, Tyner Middle School, where we were with the kids who were driving the violence. At least we were getting in the way. At least we were able to spend time and see what's going on in the house. So I would say mentoring on steroids and just being available and getting in the way. Something that I say relationships are the new form of currency. And I've built my career on building relationships. And that relationship can be the difference in somebody pulling the trigger and the difference in somebody putting down. As Demetrius says, my phone is on 24/7, and heaven forbid that I don't answer it when a young man needs to talk. And I say, well, I just going back to sleep. And when I wake up, somebody's been killed because I have the same pager that the police have. So I everything that happens, I get it. So those are the two things. Just mentoring on steroids, people with a sense of urgency, and just kind of knowing the times, and the time is now.
Yeah, and those are evidence-based initiatives, what he's speaking about. They are evidence-based. And if we could get in partnership with some of the departments, such as the community development, the community centers staff, in bringing some of this to fruition.
Let me say one
I
more
think
thing.
that was it.
And just that even the Orchard Knob program that we're doing on Wednesdays, Ms. Carroll, I believe that we need to get police officers from the outside in. We need to get young African-American males not scared of police. And that's what we're doing on Wednesdays at Orchard Knob. And it's been very, very good dealing with some of the kids who have behavior issues, being able to see the cops in a different light. So those are the things that I feel like moving forward that we can do. We need to be more prevention and intervention. Yes, we have been reactionary in years past, but I think as we turn the steering wheel, prevention and intervention have to be our way. So that's how we can do it, I think. Thank you.
You good, Councilwoman? Councilman Ledford?
Chairman, thank you.
Troy, y'all not going anywhere, are you?
No,
Okay. Well, I just want to make sure y'all, just hang around. I don't mean stand up at the podium, but just hang around.
Okay.
Go ahead, Councilman.
thank you, Chairman. This question is, I had it written down, but I was going to try to pursue it offline a little bit. But I heard Deborah say something about see something, do something, if I have that correct. And one of the conversations we have driving around in my district a lot, my wife and I, is what can we do? Not as a council rep and his wife, as a community. And where does the community fall into this responsibility? We put a lot of burden on our police department to catch criminals but we put a lot of burden on people like Deborah and Troy. But what can we do? And and that's a rhetorical question for now, but I want and hope that I see some call to action as a citizen of this city, as a resident of this county. And I applaud Mayor Kelly for taking this so seriously. And I hope the next county mayor will step up and do the same and come to the table and address this holistically and with a spirit and building this bridge solid. But I want to know, not today, that's a direct answer, but I want to know what responsibility can I put on myself and ask, what can I do? Because these are our children. This is our community. And I'm not going to sit on the sidelines. That's why I'm up here. And I don't think people, and I know people in this city, they're generous, they're good. They want to help. I believe that wholeheartedly. I look around this room and I see dedication to that. And I think there's thousands and thousands and thousands of more people. If we can help them to know what to do, and I think that some of them just need direction, and we need to let them know it's okay to help. And again, thank you. Thank you, Chairman.
Really quick on that, because I think one of the ways that we can actually do that is to model that behavior. one of the things that I left Woodmore with in the 5th grade class about cyberbullying, I left a challenge for them to be the ones that help each other, to become a community amongst themselves, where that community not only is at Woodmore, but then at Dalewood and then at Brainerd. I think a lot of our young people have a mentality of us against me against them, right? And I don't know that they've actually had people teach them how to be a community amongst themselves. And I think that's something that we can definitely do, but you know, we can do it early, but we have to model it, right? So when Troy works with different gentlemen who do an amazing job, and they see that coordination between them, and then we model it, and then we share it, and then we teach it. I think that's one of the best ways to be able to do what I think what you're communicating.
Councilwoman Burrs?
Not a tough one, Troy. So at first, when I say we started it, you guys, they started this at the Family Justice Center when Reuben, way back. We got a grant for it, and this is where it all got started. So when I say we, that's what I'm talking about. And we were proactive and not reactive.
Sure.
And now, because, and I've heard some of the talks and the tough talk, the tough love talks that you guys have done with the kids, and the kids really respond. So now we've turned to reactive, and because there was a hiatus because of COVID. So let me ask the probably politically incorrect question. And Dr. Lambert, I think this is for you as well. We see the youth centers, our community centers, as a focal point. I mean, they're great. They're the place where Councilman Coonrod was talking about sex education in the schools. And that's where we've been able to do a lot of things with our kids in the community centers, because that's where the kids were. And with a wink, we've been able to do really good stuff with them. So where do we stand? Because the problem seems to be vaccination. And I know I'm not supposed to say that or talk about it or blah, 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 but that's the problem. So how do we get all our kids aren't vaccinated, and I understand that, but how do we deal with keeping our staff healthy and letting things go ahead? Because as you said, Dr. Lambert, one of the things that is in the way is everybody getting vaccinated, which is their choice. I got it. But it's putting a big burden, or it's a forced hiatus. Jonah, you keep telling her the politically correct things to say. So, I mean, I'd say this to the press or the TV or anything. So let me own the responsibility. How do we balance this?
I get this question so much, and I don't mind answering it, and I'll
Thank
answer
you.
it as many times as anybody wants to ask the question. It's not my first rodeo with vaccination issues. As a branch chief at the National Immunization Program at CDC, at our conference, we always had demonstrators. We always had people who were against vaccinations, didn't understand. And what we will do, what I did then in that role, and what we will do now, is we will continue to answer the questions. We encourage those questions. We will provide as much information as we can. We are developing awareness programs about what this vaccine, how safe it is, how effective it is. We will answer all of the questions from all kinds of angles that we get. We'll continue to do that. There will be no weariness in answering questions and educating individuals about this vaccine and the fact that we could be past this. We can get past this, but we do need, and everybody, absolutely everybody's not going to be vaccinated, because there's going to be medical reasons for people not to be vaccinated. But if we can get to that 70%, and we're getting there, There's some populations in some of our hardest hit areas with health disparities their vaccination rates are much lower than that 53% that we're seeing for all of Hamilton County. But we're going to, and that's what I do. That's what we will have our nurse navigators doing and all of our other staff. We're going to answer the questions as long as they've got questions. There will be no weariness around answering questions and providing information for individuals, because I do think the information, the knowledge is key, and meeting people where they are and answering the questions that they have from their perspective. Many of us are fortunate that we've been around healthcare, and so we understand a little bit more about the science, that kind of thing. And so it's okay to have them ask those questions, and we're going to keep answering. I stood with a woman at I believe it was at an event that Councilwoman Coonrod organized. And I believe I stood with a woman for about an hour and a half, because that's how long she went with her questions after the event was over. There's not a problem with that, because people need to understand. They need to understand that we want them healthy. They want to be healthy. I know they do. So we just need to continue to educate, provide information, and provide it in culturally appropriate, language appropriate manner, so that they get what they need to make the decisions that they have the right to make.
That was the most beautiful answer I've ever heard. Joda, you can exhale. I thought you were going to pass out when I asked that question. It's okay, Joda, to be honest about these things. So let me ask you something, Dr. Lambert. What percentage do you need to get to 70% of whom? Our staff, the community, what?
When I use the figure 70%, I'm talking about the total population. And for my purposes in this role, I'm talking Hamilton County, City of Chattanooga, so about 70% or more. And there are some experts who are saying we may need to be above that. But everything I've ever experienced, in my experience, has been 70% or so. So that means there's going to be a lot of folks who are not vaccinated. So about 70%. And we're getting there. I think we're 53%. And when I started this assignment, this appointment, we were barely at 40%. So we're making progress. I think what concerns people is when they see the variants, when they see how rapidly this latest one, Omicron, is spreading. No matter how serious or mild the illness is, that has driven, so some of the vaccinations have gone up just a little bit. And we continue to, the regulatory agencies, and again, I had a couple of assignments with regulatory agencies, one of them with the vaccine reviewers. And there is always ongoing review of the data that comes in about experience, reactions, if any, with any drug or vaccine. So we continue to learn about those vaccines. And that's the kind of information we need to be getting to individuals in the community about. The latest data is showing this. It's really safe. That's the only reason it's been approved for children ages 11 to 5. And we'll continue to do that. Our regulatory system in this country is, if it's not the best, it's among the best in the world.
Sure.
Very thorough, very rigid.
I just think our centers need to be open. And
I agree.
We're dealing with some outliers that are keeping them from being open, and it's hurting our kids.
Some of what we're doing is targeting some of the individuals who can help us with members of that community to get the information they need to make the decision they need to make about vaccination. So we're doing that. We did a great job through some of the faith leaders. We could do that through schools, that kind of thing. So we're targeting other individuals that we can get information to and who can help us partner in the community to get more people vaccinating, get more information to people so that they make the decision that they need to about vaccination.
I do want us to take a break at 15 after. Troy, don't go anywhere. I've just got a paper filled with questions, and Joda, some of these may be for you. I want to hit on something that Councilwoman Coonrod said earlier about this has to be a family effort in order to curb this violence.
Come on now.
And so I'm going to make a statement here and assume that this intervention team is just one part of a comprehensive plan. And maybe, Joda, what we need to have presented to this council is what the comprehensive plan looks like, because the family has to be involved. It has to be the total package. We say we have a Department of Family Empowerment. I've not ever seen it do anything, and I'm just going to be honest.
Well, we do have an Office of Family Empowerment.
I'm
and
sorry?
We have an Office of Family Empowerment.
Office of-
and that is actually, OFE is a national model that we get federal funds for. But I'm happy to go into more detail about what they do.
We need to see results from the Office of Family Empowerment. That's all I'm saying. I would be interested to know of the 830 on that graph a while ago, the 830 juveniles that were involved in gun-related incidents in 2021, what the breakdown, how many came from a two-parent family home? How many came from a one-parent family home? How many were in state custody, so on and so forth? I'd like to know that. Can we get that information?
I'm not sure. I'll have to double check. I'm not certain what data the police department collects. I mean, but to your point, Chairman Anderson, it's no doubt that being in a...
The intervention specialists are polling for that.
All right, go for it.
So Tommy came up with a survey that is actually asking that very question. Any school that we go to, the students that we engage with, they're being given a survey, and that's I think that's the first question, isn't it, Tommy? Are you in a single family? Yeah, top 3 questions. We're asking them, A, are you in a single family home? Do you have family members incarcerated? And I believe income level might be one as well. Do we ask for the income level? No? So we're trying to identify.
I'm really not as concerned about income level as I am two parents in the home. And I think that takes care of itself to some degree when you have two parents in the home.
Yes.
How many of these kids, and I'm gonna go out on a limb here and say most of these 830 were probably male with no father figure at home, would be my guess.
I think that's the one. So not only are they in a single family home, but they're in a single family home with a female.
That's right. Yeah.
Right.
So,
And I believe it's almost 80% of them are in a single family home, probably more. Yeah. So that we are asking that particular data.
so we have to, as Councilwoman Coonrod pointed out, we've got to circle back and start addressing that problem and take a look at that, or help facilitate that. The other thing that I want to ask, Ruben, I don't know, Joda. So even when our community centers were closed, our house of worship were open. Is it possible to take this program into the house of worship? And I know that we seem to be having some difficulty perhaps getting into all of the schools. We have to be invited, which leads me to a question that I wrote down. Do we have an MOU with Hamilton County school system? And if not, why not? I think we need to have an MOU with Hamilton County. We have somebody on this council that can probably help facilitate that. I think it would be important to have an MOU with them. That being aside, I think it would also be important to partner with our house of worships, because I think that's a resource there that perhaps we're not tapping into, that we could identify some of these struggling, even families at this junction, and to try to, and I'm going to use the word minister to the whole family, and not just to the troubled kid. But is it possible to start going into our house of worship, Troy?
So I just want to point out really quickly too that, the Kelly administration is engaging and has over the last 3-4 months a broad coalition of pastors. So Mayor Kelly has been, and the question is exactly the mayor posed to these houses of worship and faith leaders is, we need your help on a whole range of issues. We see an avenue for them to get involved in early learning.
Right here's some people that need to be in them, involved in it.
So I think it's important that the answer is yes. We absolutely can engage houses of worship and faith leaders in more ways, and we have several meetings coming up. We also have Chris Sands coming onto our staff on December 13th, who is coming to us from Olivet Baptist Church and leading our community engagement work. I want to point out we do have an MOU with Hamilton County Schools, and we could make sure that we talk with them. I do feel like our community forward investment helped build the bridges to some of these conversations that we can have with our school system. But to your point, getting to the root causes, getting to thinking about the entire family unit, thinking about how do we get to single parent and single family homes in the first place, oftentimes is economic. And it's also related directly to incarceration. And so we have to think about these things holistically. And that's something the Kelly administration is
I
committed to.
agree. It's a comprehensive approach.
That's right. And I would ask, I think Ms. Deborah said this early on, but the one thing that could be very useful and valuable to us is a little bit more time. I think we are working on pulling that comprehensive strategy together. But again, this administration's been here for just a little over 6 months, and this is a top priority for us. And so we anticipate in the first quarter of next year having something a little bit more comprehensive.
Well, I think I would, and I'm sure others would like to see that plan unveiled here, and let us know what the comprehensive plan looks like.
Absolutely. Thank you, Chairman.
I see no other lights. Councilman Byrd, good to have you with us here today. You got any questions for Joe or Troy before we dismiss? Okay. All right, Joe, I want to thank everyone for coming today for your presentation. It is helpful to understand a little bit about what's going on. I think we do need a follow-up to let us know.
We absolutely will.
The total package, and I think this is just one part of the answer. With that, I don't see any other lights, so we're going to take a short break, and we'll reconvene at 3:30.
Thank you, Chairman.
Oh.